With Talking Health, I'm Jessica Harding. Obesity is one of the UK's most pressing health challenges. As the NHS faces increasing pressure, it is evident a new holistic approach is needed. Here to discuss this is NHS doctor and longevity medicine specialist, Dr. Alice Thomas. Alice, what does the research show?
At Apex Medical, we have seen that there's this disarray between patient satisfaction of what's going on in the NHS and their healthcare. So we did some research and we're mainly looking around longevity and healthcare and obesity. And we found that actually 64% of the population at the moment are obese or overweight, which is really, really concerning and something that we really passionately feel we need to look into and help with a bit further.
What are some of the challenges in tackling the obesity crisis?
I think first of all, the NHS is thought to be quite reactive rather than proactive when it comes to this approach. About 53% of people we found weren't comfortable talking to their GP about, health just in general and their general longevity and general lifestyle changes that they could make. One size doesn't fit all. And it's very, very hard to know what the right health advice is. But I think it goes back to education. And if we can sort out the education of the general population as well as medical doctors, giving people tools that they can use in order to put things into practice, I think that is where we need to start. So at Apex Medical, we're dedicated to using evidence-based approach medicine techniques that we can use to help people.
What are some methods to help people lose weight?
So I think that's where we come in at Apex Medical, using the evidence-based approach to target things. So it has to start with our lifestyle, whether it be good habits with our eating, exercise, sleep, stress management. This is the foundation of a healthy lifestyle, and these are the changes that we need to make. And I always say changes don't have to be huge. Little things can come in, because the point is we want these things to stick and become part of a lifestyle. Prioritizing sleep is key. When we talk about diet, there's a lot nowadays about intermittent fasting, which is very popular and very beneficial, not only for weight loss, but in a whole benefit of longevity factors, such as helping with mood, anti-dementia, anti-cardiovascular risk factors. And with the diet, also alongside that comes a very high protein, low carbohydrate diet, trying to avoid processed foods and sugar as much as possible. If exercise was a drug, we would all be on it. It's absolutely so good for us to exercise, not only for our mental health, but also for our bodies, our longevity and weight loss. And then third, stress management is something that is so important.
For more information, visit www.apexmedicalacademy.co.uk. Thank you, Dr. Thomas. With Talking Health, I'm Jessica Harding.